Thank you all. As you all know, the International Forum for Promoting Homeopathy was formed by a group of homeopathic lovers, doctors, and students at the time of pandemic named COVID. And we were able to connect between doctors from different parts of the world. More than 65 countries participated in our sessions, and all of them presented subject on various subjects, and all the presentations were excellent. And we have 3 sessions in a row. That is 7 to 8 our Hindi session, 8 to 9 we have our international session in English, and 9 to 10 we have our local language session in Malayalam. Today, as you all know, that our guest is Dr. Prakash Rao, sir, is one of the person who has contributed a lot of research work in our sessions. He is a person who are able to guide us how to research and what is the purpose of research and what are the things we can do with research. Anyway, let me introduce sir once again. Sir has completed a BA and MD in homeopathy, then PhD in homeopathy, holding a postgraduate diploma in physical medicine and rehabilitation, undertook various projects with the UNICEF and AIDS Control Society, and the winner of many awards for the outstanding work for homeopathy. He has more than 30 years of experience with the Central Council of Homeopathy, and even doing research work for the benefit of homeopathy. He's a person who is working hard to bring homeopathy to topmost level, to prove the world that homeopathy is the best science in the world. And today, as you all know, the subject is what is cure and curative part. Already we have 3 sessions on the same subject, and today it will be the fourth session. So let us proudly welcome our beloved guest, Prakash Rao. Welcome, sir.
Thank you very much, sir. Dr. Dhanesh, thank you very much for introducing me. Sir, today we will take a topic which we have completed already 3 sessions. But to be this session, we will complete the drug and little drug proving as well as drug relationships, how they came. Usually these topics are not taught in college because it is not involved. See, for example, drug relation has been written. See, for example, arsenic album, follow-ups, arsenic album, complementaries are Tuja, Carbovich, natrum sulf. In the same fashion, natrum sulf complementaries are Carbovich, arsenic, Tuja. Tuja complementary is natrum sulf, arsenic, and Carbovich. But how they developed, what happens, in which they are complementaries, where they are antidotes, where they are inimicals, and where they never act at all. These studies were not covered in college. So before going further, let us briefly remind you or making you a refresh of all 3 previous topics so that you will very well grasp and discuss about the drug proving, drug action, drug relationships. Okay, sir. We are taking what is cure, what is curative. Usually in homeopathic philosophy organon, cure is well defined by Dr. Hahnemann, because when Hahnemann invented homeopathy, in those days, the cure, the treatment used to be very unethical practices used to be there. So he wants a disease has to be cured in a proper way. So he developed a word cure. Before that, cure was there, but cure was only a nomenclature. What is cure that Hahnemann defined is science and intelligence and making the life force and keeping the life force to keep the functions of all sensations and all functions in harmony. Cure, once the disease comes, the physical part of the body will be affected when the normal sensation and functions are disoriented, and after the treatment, the disorientation has to go and the former state of health has to be taken place. It was discussed in aphorism number 5, 6, 7, and 8. Cure is permanently removal of the suffering. He says permanently removal of the suffering. In those days, these are the homeopathic definitions. Health, human beings, bringing the farmer. The highest idea of cure is rapid, gentle, permanent restoration of health, annihilation of disease in its most sensible on easily comprehensible principles without giving too much of trouble to the patient, without too much of diet restrictions, without the discomfort of the patient, without providing him anything physically discomfort to the patient, the cure has to taken place. So for that, the second aphorism covers the highest ideal of cure is rapid, gentle, permanent restoration of health, annihilation of disease, and most easily comprehensible principles. The modern definition is the WHO definition is cure is entirely different. Now, symptoms for more than the disappearance of symptoms for more than 3 years is known as cure. See, they treat HIV, they treat tuberculosis. The tuberculosis bacteria, the Mycobacterium tuberculosis, the sputum test should be negative. Patient should be free from cough, cold, coryza, and any patient should not be nourished. He should not lose his weight. That's all. If the symptoms are disappeared for more than 3 years, that is known as cure according to WHO. The Hahnemann cure is permanently removal of the disease. The WHO cure is permanently removal of the disease for 3 years. So, next slide is about what is cure disappearance of signs and symptoms. Modern science consider the cure disappearance. See, I already told the word cure comes from the Latin word cura. This also you know very well. I explained you. So this is a cure is a treatment eliminates the disease or illness such as bacterial infection. See, whatever may be the infection, according to homeopathy, what is the source of the infection, whether it is viral, bacterial, protozoal, or anything. So that has to be totally treated. Whereas according to allopathic system of medicine, if the bacterial infection means the bacteria has to become negative. If the viral infection means the viral infection has to show negative results when the investigations are carried out. And if the parasitic infection is there, the parasite has to be disappeared. This is the WHO concept or allopathic concept for curing the disease. Now, a cure is different from recovery. See, homeopathy recognizes different parts of different sorts of cures. Cures in the sense removal of the disease. See, a cure is different from recovery. Means getting better and not abusing the substance. A person will recover. There will be a small injury. The small injury never needs any treatment. So a person will recover of his own. That recovery is known as a total cure according to homeopathy. But a recovery without any medicines or improvement without any medicines or patient becoming normal without any medicines is known as recovery. And a patient improves after the medicines, that is cured. These small definitions also we will observe in homeopathy. That is the study that Hahnemann conducted. He was so perfectionist, he was so sensitive. A recovery comes automatically without taking any substances or medicines, but whereas a cure comes only after the medicine. These simple definitions are not covered by WHO or the modern systems of medicines. Why we have to give definite? There is no such book as such, the philosophy or the logic or the working out of the patients in allopathic system of medicine. Only in homeopathy we will find there is a philosophy known as organon of medicine that gives us guidelines to give medicine, guidelines for repertorization, guidelines for taking the case, and guidelines of the Hahnemann that he followed. It gives the potentization, it gives single simple remedy, it also gives the what is actually a physician has to do after completing his studies. So in that such studies, some of the topics are missing. So we are going to discuss about that. A cure is when the treatment makes health problem go away. See, a simple term, but understanding is little difficult. Not expected to come back. Whereas in allopathy, if it is relieved, it's okay. Relief is nothing, recovery. Recovery without any medicine. Relieving the problem with medicine and without medicine. They don't care for cure. But in homeopathy, removing the problem. Some health problems have a cure. For example, to treat athlete's foot. See athletic foots, bursitis, calcaneus for cervical spondylosis, first and second stages of tonsils, first, second, and third stages of peptic ulcer, chronic pulmonary bronchitis, and various types of skin disorders, including psoriasis, childhood asthmas. These all have cure in homeopathy, but at a particular platform, they were not exposed scientifically, and the data has not been collected. So homeopathy has not got a scientific name. Homeopathy is very popular as such. Patient will be in search of homeopathy once the case failed with allopathic doctor. But the scientific study has to make homeopathy to be used by even allopathic doctors, and it should stand in the society that a allopathic doctor has to refer the cases to homeopathic doctor. That seat, that capacity is not being achieved because the scientific and systematic studies were not recorded. It is not that they haven't cured any disease. The diseases were cured, but they were not documented and they were not submitted to the scientific committee. See, homeopathy people previously used to have nursing homes in villages. They used to conduct deliveries, but that document is not present. So, in the same fashion, for various things, homeopathic doctors did so much of work for last 200 years is not documented properly. So, we could not attract the scientific world. So, what is cure and what is curative? In chronic diseases, when we take the classification in the practical part of our organon, the chronic diseases shows disease with fully developed symptoms. Even the disease conditions were not classified in allopathy. For them, the disease is disease, whether it is chronic or it is acute. The disease must be cured or may not be cured, it has to be suppressed. For them, the value of cure, the disease classification makes. For them, the disease classification is antibacterial, antiviral, anti-parasitic, malignancies, tubercular tendencies, contagious diseases, infectious diseases. It is like that. But for a homeopathy, they are chronic diseases and acute diseases. They themselves demarcated what are the best possible diseases, what are not best possible diseases that can't be cured and cured. This is fully written in Organon of Medicine and it has covered. But unfortunately, the studies during the college education never covers, never explains the student that what are the diseases that are mostly curable in homeopathy and what are the diseases that can be controlled in homeopathy, that can be palliated by homeopathy, that will be suppressed by homeopathy, and where we will, in the social platform, where we really stand and for which we have to claim for cure and which we should not claim for cure. This is not demarcated in college education or in curriculum or syllabus. So there are chronic diseases, diseases with fully developed symptoms. What are the disease fully developed symptoms? Again, they are classified into two varieties, non-miasmatic and miasmatic. In non-miasmatic disorders, many diseases are from unhygienic conditions or iatrogenic causes, that is, many diseases are from drugs, the side effect of the drugs. Why these iatrogenic causes took so much of specialization in homeopathic qualification? In Hahnemann days, the iatrogenic causes, the drug side effects used to be too much. For example, the ipecac has to be misused. The ipecac used to be given for loose motions and cough. Whereas the ipecac, if maximum it is taken, it will produce spasmodic conditions of the intestines and produces bleeding from the intestine. So patient used to die with excess dose of ipecac. In the same fashion, cupromet, the toxic symptom of the cupromet is excessive infection in the intestines and it used to produce constipation. But the cupromet used to be given for childhood diarrhea and cough. So in those days, Hahnemann days, The non-miasmatic diseases, one of the iatrogenic causes that are the toxic effects of the drugs. Suppose the iron, they know in those days the iron deficiency will cause blood loss. They never used to know that it is hemoglobin. So they used to misuse iron. They used to take excess quantities of iron that used to cause tumors in the intestines, and patients used to die. So they do not know. That's why this particular iatrogenic drugs, non-miasmatic drugs that will cause the chronic disease were noticed by Hahnemann. In those days, again, the occupational disorders, because there used to be various factories, the factories chemicals used to produce occupational hazard. Those occupational hazards were also noticed because Hahnemann used to get upper respiratory tract infections and skin infections because the leather factories, the cotton cloth factories used to be very high in Europe, and patients used to come to him with the symptoms of dust particles of the cotton that used to enter into the lungs and that used to cause. That's why for him in those days, the non-miasmatic disorders used to be personal lack of personal hygiene and drugs, iatrogenic causes, and occupational disorders. Nowadays, the government and the people are taking too much care about the occupational hazards, drugs, iatrogenic causes, and from hygiene. Despite of all these things, the modern disease is pollution. Pollution in Delhi, pollution in all big cities like Bombay, Chennai, everywhere. That pollution is increasing carbon monoxide in the blood and ultimately causing breathlessness, that ultimately leading to chronic oppressive pulmonary disorders, and that became one of the causes of the death in Delhi with heart. Who comes with heart attack? Ultimately, they develop the infection of COPD in the hospital, and they die because of COPD. This is the non-miasmatic chronic disorders. Then come to the single disease and compound disease. They are the miasmatic. The miasmatic qualification in those, the bacterial, the viral studies were not so popular. So he himself demarcated some of the disease conditions from one stage to other stage, from the second stage to third stage, from third stage to fourth stage. So for the disease conditions with pathological investigations, whatever he observed from one stage to other stage, he named it as psora syphilis psychosis. And in that again, diseases with few symptoms, they are called as one-sided diseases. Diseases only with mental symptoms. Again, he described the diseases with few symptoms into two varieties: one-sided diseases that are mental diseases and local diseases, surgical and non-surgical. What are the local diseases? See, miasmatic disorders such as psoriatic, syphilitic, psychotic. These psoriatic, syphilitic, psychotic, this is a specialty of the homeopathy. Only a homeopathy doctor will understand the psoriatic, syphilitic, psychotic condition of the disease. And at the same time, Hahnemann also practiced in his, he made the drugs into anti-psoric, anti-psychotic, anti-syphilitic. Why he did anti-syphilitic, anti-psychotic, anti-psoriatic? Number one is the action of the drug. Number two is its curability of the disease. Number three is its interference into the body. Number four is it used to cover all the symptoms of the drug proving. So he made them as like antibiotics, but he made it as anti-miasmatic. So the miasm specifically, sometimes we will find double miasmatic diseases, triple miasmatic diseases, single miasmatic disease. The demarcation is not appropriate or accurate. So every follow-up doctor has started demarcating these miasmatic diseases according to his convenience. So pathologically also, it is tough to demark a disease as psoriatic, as psychotic, as sorrow, syphilis, psychosis together. So that's why there is a confusion among the students or the practitioner, which has to be called as psychotic, which has to be called as syphilitic and psoriatic. So when we take up miasmatic studies, merely taking the total case on the miasmatic basis, or merely taking the case on mental disorders, merely taking the case only on physical disorders, never bring the success in homeopathy. That's why the homeopathy doctor always insists on totality of the symptom, totality of the symptoms. Totality of the symptoms of acute case, totality of the symptoms of chronic case. So usually what happens, everything in science will have a limitation. In homeopathy also, there will be a limitation for the methodology. These limitations were not taught. So a physician who comes off the college, he will have a confusion. For example, totality of the symptoms. Which totality of the symptoms must be taken for which disorder, where the totality of the symptoms will have a limitation, and where the totality of the symptoms will help. For example, if a non-curable case, suppose there is a fracture of the bone, the fracture of the bone, if the physician never understands that it is a surgical disorder, it has to be applied plaster. If the surgery is needed, the surgery has to be applied. The bone has to be properly placed and a bandage has to be applied. So if such case comes, if we take totality of the symptoms, that never works out. We have to send it to a surgeon. That's why Hahnemann divided in those days. He understood properly the surgical and non-surgical disorders. The non-surgical disorders, double miasmatic or miasmatic, local diseases, local diseases in the sense particularly to one part or to the total body is affected, there only our totality of the symptoms has to be applied. There only the totality of the medicine will work. There the holistic approach is very suitable. But the holistic approach for non-holistic disorder, this was not taught in colleges. For example, there will be an acute disease of aphthous ulcers. For aphthous ulcers, if we are going on probing for holistic approach, if the aphthous ulcers are not because of syphilitic in reason bacterially, if the aphthous ulcers are not of viral in nature, it is simply small aphthous ulcers, and there the totality of the symptoms, the mentality of the symptom is not going to work. And when we apply also, patient is not going to interact with this because he will have a small symptom and that small symptom has to be cured. He expects that. So usually what happens in the colleges, such type of education is lagging. For everything, they will say that holistic approach only for chronic diseases. What is chronic disease? Again, if the disease condition is more than 6 months, not responded to any medicine, even after responding, simple palliation, after simple palliation, the disease again recurring in nature with infection, without infection, with properly curable, why it is coming up? For example, let us take the example of simple skin disease, psoriasis. It is also curable or suppressed in allopathy. So what happens? The suppression, taking ointment, taking some of the medicines, anti-psoriatic medicines, there are also present. They will give that psoriatic, they will consider that as an infection. So anti-inflammatory, immunomodulation medicines they give. When the immunomodulation is given, it works as a immunomodulatory medicine for 3 months. After 3 months, it will, the medicine second reaction, what you call is, what in allopathy it is called is half-life of the drug. Half-life of the drug means the drug, once allopathic drug is given, it will stay in the body for some time. Though the drug is withdrawn, the symptoms never, the cure never disappears. It will continue for some time. But after some time, the efficacy of the drug or the half-life of the drug will be finished, where the allopathic drug will be expelled totally from body. Then again the symptoms will reoccur. When the symptoms reoccur, patient comes to homeopathy. So we have to understand what is the genetic cause of the disease, how much we can control, why allopathic doctor could not control, what is the disease that has to be taken, whether the family history is present. In such, the holistic approach will work out very well. In if such cases, suppose if we compare a psoriasis with aphthous ulcers or psoriasis with simple sneezing, for sneezing we need not take a big holistic approach case record. That has to be divided. These type of studies will not be entertained in homeopathic medical college. For everything, they say that your selection of the drug is not up to the mark. You haven't selected the simillimum. When you haven't selected the simillimum, you will not achieve the cure. So what for the simillimum has to be searched, what for simillimum should not be searched, which disease condition needs simillimum, which disease condition needs instant medicine, this has to be clarified. So when they could not clarify what happened in homeopathy, there is lot of literature, pathological prescription. See, even the repertories have been divided on a pathological prescription and holistic approach, not on the materia medica that has been proved. So there is a conflict of the repertories. One repertory talks about other repertory. When we practically follow the repertory, we will understand. If we take a Kent repertory and if we take a modern repertory, we will find every symptom there. But whether it is verified, whether it is evaluated, whether it is present in materia medica is always doubtful. So such type of critical thinking is not possible in college education. So after college education, the physician who comes into the society and he practices, he will confuse. So again, we will come to the disease with fully developed symptom, one-sided disorders. These one-sided disorders, they clarified, Hahnemann clarified only mental symptoms, diseases with only few mental symptoms. Suppose a schizophrenia patients will have lot of symptoms, whereas a depression patient will not have any symptom except anxiety and going in between public. So what is the pathology of the disease? Previously, we used to take symptoms, but nowadays the medicine has developed so much. The pathology of the schizophrenia, the pathology of depression, the pathology of anxiety neurosis, and some of the anxiety neurosis and some of the diseases such as hypertension, such as diabetes, they also produce depression. If the diabetes is not controlled, the diabetic patient will have suicidal tendencies. If the hypertension is not controlled, the hypertension patient will enter into anxiety neurosis. Until and the anxiety neurosis is controlled, the hypertension will not come under control. So such type of associated mental symptoms are also present. They were hinted in Hahnemann's organon of medicine. But in allopathy, there was no reference for about till last 10 years that anxiety is nothing to do with hypertension. But nowadays, in modern treatments of allopathy, we will find a hypertension patient being given antidepressants too, because the antidepressants are controlling the hypertension, the cause of the hypertension, that is stimulation of adrenaline. So they, in other words, coming to the holistic approach. In homeopathy, such type of anxiety and hypertension, depression and diabetes, these mental symptoms were placed in a highest rank, and we have to always consider that these mental symptoms have to be studied and they have to be placed highest symptom, and we have to demarcate a disease condition that is curable. Suppose a physician opens in his clinic, we have to make studies in a such a way that a standard operative procedures for the diseases that have to be cured, diseases that have to be managed, and the disease that have to be palliated, suppressed, and recovered. So there should be a gross demarcation where the homeopathy syllabus, even the latest syllabus of this year also, never concludes this. And it is a handicap. That's why the homeopathic student who comes of the college is not in a position to compete with allopathic doctors. So that enough recognition in the society is not coming down. Why? What is the recognition in the society means? The Davidson I will tell you one thing. The Davidson textbook of medicine, the Cecil and Loeb textbook of medicine, they are also writing in the therapeutics that the alternate systems are very good. Suppose if you take Davidson textbook of medicine, I request every audience here, you kindly go to the Davidson textbook of medicine and read cervical spondylosis. There that homeopathy has a claim that the cervical spondylosis pain is being relieved, usually with calcarea group of drugs. He will write, but such a type of writing even allopathic doctor do not know. When the allopathic doctor criticizes homeopathic doctors, the homeopathic doctors are not in a position to tell Sir, you kindly refer your Davidson textbook of medicine. He writes about homeopathy. See, there is a separate chapter on Sicily and Loeb, that integrated system of medicine and the role of alternate system of medicine. In social and preventive medicine, there is a separate topic about alternate systems of medicine. They will give the total history of homeopathy, and there is around 10 pages to 11 pages over the homeopathic chapter. So such type of things are not known to homeopathic doctor, are not known even to allopathic doctor. So when the question comes of criticizing homeopathy, we immediately raise to the doctor, sir, your textbooks have covered this. And we are equivalent with you in understanding the disease conditions, and we are equivalent with you in treating the disease conditions. We know our limitations. Whatever the cases that have been left by you are coming to us. The cases that have been left by you are being treated. Around 90% of left out cases are being treated. So our approach is more scientific than you. If you want, you kindly refer to your Davidson textbook of medicine. He covered these chapters under homeopathy that have been cured. They never discuss about Ayurveda, but they discuss about homeopathy. And no textbook has written anything that is against homeopathy. So these one-sided diseases, again I am coming, diseases with fully developed symptoms. These one-sided diseases are diseases with mental symptoms. Usually the schizophrenia is a disease that never comes down only with homeopathic medicine. And curing schizophrenia is the toughest task. The depression, the anxiety, these are the psychiatric disorders. They definitely come down with homeopathy, but schizophrenia never comes down with homeopathy. See, you kindly go through tuberculum, medicine tuberculum under Kent. Kent says the alternating tubercular symptoms with schizophrenia. How a tuberculosis patient will become a schizophrenia patient, how a schizophrenia patient will become tuberculosis patient, how tuberculum CM potency and LM potencies have cured schizophrenia, how to prevent tuberculosis. You see, homeopathy is against vaccination, but at the same time, homeopathy is not, see, they supported prevention of diseases. So under the prevention of diseases, Kent speaks about removing of pseudosora by giving high potencies of tuberculum to a pregnant woman. So here also homeopathy, where we cannot cover in our syllabus. See, we are against vaccination. At the same time, we are who support you of the prevention of the disease. The Kent used to believe that if we give a medicine to the pregnant women, so the pseudosora and sora will be prevented. The sora classification, the sora limitation, from where there is no wall between sora and psychosis, syphilis. There is no wall between starting of the sora. So what is exactly starting of the sora? What it prevents the sora and pseudosora? That was not discussed. He only said the sora and pseudosora will be prevented. The tuberculosis will be prevented by giving tuberculum. So hats off to his knowledge, because in those days the gadgets available for him are only few. In that few, he discussed about the various topics, and his hypothesis which he framed, that schizophrenia and tuberculosis goes hand in hand. That is the latest theory in allopathy, that the tuberculosis is the infection that will cause schizophrenia, and the previous family history of tuberculosis patients will have more schizophrenia history rather than others. So Kent never studied any pathology or immunology or genetics, but he has written that any schizophrenia patient will be a tuberculosis patient. Any suppressed tuberculosis will lead to schizophrenia. Any schizophrenia and tuberculosis has to be prevented, means give the maximum highest doses of tuberculum to prevent pseudosora. The confusion is, what is pseudosora? The symptoms which he going to prevent, that he was not clear, because for the knowledge that has been given in those days is not sufficient, and whatever the intuition he got, he has written. So we have to always praise Kent for his extraordinary knowledge. So these mental symptoms are not curable. Local diseases, again, we have to search for surgical diseases and non-surgical diseases. I briefed the chapter only to make you to understand today drug relations. See, these five diseases are fully treatable. I am not telling that they are curable. They are treatable with homeopathy, they are treatable with allopathy, they are treatable with any other system of medicine. These disorders, complications are the best way treatable in homeopathy. For example, tuberculosis. Secondary tuberculosis is other one. Tuberculosis cough. A tuberculosis patient, despite of his totally cured with allopathic medicine, he will have now and then the cough. It is A negative, aseptic, A negative in the sense tubercular negative cough. If he go for sputum analysis, the test will be negative, but he will have little cough. This is the complication or secondary tuberculosis, or he will have weight loss. These symptoms are perfectly cured with homeopathy. Then HIV and AIDS. The HIV and AIDS patient will have total cure and his viral load will be negative after allopathic treatment. Despite of all these things, he will have loss of weight. This lot of weight can be controlled by homeopathy. Then in malaria, what happens? The malarial patient, if he is really malaria of Plasmodium falciparum, he will be given Syncona drug. That is our China drug. That is known as quinine. Quinine will be abused. How they are abused? In the sense, for every 6 hours, there will be one injection will be given for severe malarial patient. So that Syncona will go and suppress the bone marrow, and that bone marrow suppression will leads to anemia, and that anemia will affect the spleen. That affecting the spleen will be controlled by homeopathy very easily because we have medicines. There, the only drug withdrawal is present. So some of the patients will develop the complications of Syncona injection immediately after 3 injections. Some of the patients will develop after 12 injections. Some of the patients will develop after a month. But they are going to definitely develop the complications of the Syncona abuse by allopathic doctors for a malarial patient. That anemia is curable. Whereas a nutritional deficiency anemia, it is tough to treat. But whereas a complicated anemia that comes out of the treatment of malaria by allopathic medicines is very easily curable in homeopathy. These particular topics of these which homeopathy will help will not be taught into medical colleges. And though they cover that malaria, the complications of malaria, how to prevent, though the documentation is present, our colleges never provide such type of education. Even in COVID, what happened this time, you have seen the COVID anxiety neurosis, the fear of COVID, the depression in COVID, the depression, anxiety, neurosis, and other apart from mental diseases, the complications such as weakness, these all have been treated with homeopathic doctors. Now, for after COVID, homeopathic doctors became intelligent. There is lot of documentation for mental symptoms in COVID. The phobia, the anxiety, the distress, the depression, lack of weight, and lack of energy. They all will make the homeopathy will change the immunomodulation. That is the anti-inflammatory process of immunity will be treated with homeopathy, and homeopathic medicines have treated lakhs of patients from depression, anxiety, and loss of appetite, losing the weight, and even clots in the heart. The clots in the heart attacks have increased just after COVID vaccination and COVID effect. Even the patient comes to homeopathy for any fever or any other disorders, the complication of COVID disorders have come to very less. This is documentally proved. And cholera. Cholera is another disease. Nowadays, it is not coming. But however, in West Bengal and in Orissa, it is a common disorder. Even in South Africa, it is the see, a simple glucose dip also treats the cholera. But whereas the side effect of the cholera, lack of weight, weakness, at the same time, being infected. And these all will be controlled with homeopathy. And this is being documented. And homeopathic Dr. Muzamdar of Calcutta in 1946 has covered the pages of Indian history by controlling cholera through prevention of cholera through homeopathic medicines. In history, the homeopathy cure, everywhere you will find the homeopathy articles. But in the history chapter of the history, Indian history, where the cholera by single man, that is Mujamdar, has been controlled, has been noted in the history books. And if you see the Indian history, he will write that in 1946, Mujamdar has controlled in Calcutta area by giving homeopathic medicine, genus epidemicus, and that medicine is Podophyllum. He is the only person who occupied the history. Rest of all, homeopathy, coming to homeopathy India, and that Raja Manjit Singh was treated, they were not found, you won't find in the history textbooks except cholera control. That what we have written is homeopathic history by homeopathic doctors, not the chapter of history, Indian chapter of history in India has not noticed any homeopathy except Muzamdar controlling the cholera. Right. Then there are the top 10 years disorders. The 10 top disorders are ischemic heart disease. Homeopathy has not worked control fully because number one, the ischemic heart disease patient never approves to take the treatment. Number two, coronary artery diseases, stroke, paralytic stroke, and lower respiratory infections, trachea and bronchus, lung cancers, and diabetes mellitus, chronic obstructive pulmonary disorders, Alzheimer's disorder, dehydration due to diarrhea disorder, tuberculosis, cirrhosis of liver. Apart from this, snake bites. Now I will talk about you the heart attack and strokes. The ischemic heart disease patient never takes homeopathic treatment because it is an acute condition. And wherever in the villages, the acute condition don't have any probability, any accessibility to be approached by allopathic doctor, there the homeopathic doctor has been given a chance because he is the only person available in the village he gave, but he never maintained the document. Nowadays, it is very tough, difficult to treat a ischemic heart patient in allopathic hospital. So, the Central Council or any government body has not taken anything that is specially which is being used as an integrated test of medicine. So homeopathy has lost the opportunity whether it controls the ischemic heart disease or not. They will write in homeopathic textbook when the ischemic heart disease or coronary heart disease or the stroke paralytic attack comes, there will be very good therapeutics without any evaluation. See, the therapeutics writing and evaluation are entirely different. Usually in homeopathic clinics, a stroke patient after getting paralysis, when his left leg or left hand or where the both hands or both legs are being affected, when he can't walk, he will be going on taking allopathic medicine for his hypertension. But there are no medicines for paralysis except physiotherapy. After few days of treatment in allopathy, patient may be called to the house of the patient to treat a paralytic condition. There, the homeopathic doctor, if he takes 10 cases, in one case he will be successful, 9 cases he will drastically fail because there is no college combined education. How much efficacy of the homeopathic drugs will be on stroke, that is ischemic heart disease, ischemic diseases of the brain. So how these are treated? Then on heart attack also, when the patient got the first stroke, how to prevent the second stroke? No studies were conducted and they will be given therapeutics. But when you open a homeopathic clinic, the patient when he gets a heart attack, he comes to a home, they won't see what is the board, what is which doctor you are. All they need is the patient has to be survived. So whatever the Hahnemann, Kent, whatever the old textbooks are saying, give Barbovich, give Aconite, give arsenical. So they are only being followed and no further studies, no further improvement has been noticed. So by this, in the technically or scientifically comparative world, we homeopathic doctors are going. Whereas in lower respiratory tract infections, in diabetes mellitus, the patient will be chronic in nature. There won't be any acute symptoms involved with the diabetes except ketoacidosis. So remove the ketoacidosis patient and lower respiratory tract patients will come. In that also, the perfect anti-diabetic remedy with the dosage, with the action, or combined medicines have not come. If you go to a seminar, you will find in a hall diabetic tinctures, diabetic 10 medicines combined together. The same author, the factory owner, who will combine the diabetic medicine, Cysium, Jambolinum, Cinnamomum, Gilanicum, and all these medicines, Inula, Chimaphila, Ambelita, Abroma augusta, who will mix in mother tincture form and sells for diabetes, will come on dais and speak about the single remedy and homeopathy cure. These are the double standards of homeopathy. And even the mother tinctures which are coming to the market, they were also not studied on animals or on any human beings. You will find cough syrup, you will find diabetic, anti-diabetic remedy, you will find anti-hypertensive remedy without evidence base. Hypertension is nothing but a sweet killer. At any time, it may kill the patients. There is no evidence base, but mother tinctures will be sold. Most of the new doctors, without knowing, because they believe the literature that is present in homeopathy, because the science has so much developed, the literature believing became a habit. No bad literature or no literature that is not true will not come in scientific journals. But in our place, it is not like that. There won't be any research laboratory attached with the drugs and pharmaceutical companies, but they produce the medicine and they sell for survival. Many homeopathic doctors, many patients will come and ask. So for that, many homeopathic doctors were forced to use these medicines to maintain their private practice. But in college education, nothing will be taught authentically, and if a student will not be go with a right soldier to the society and cure, he will develop his own materia medica, and these are that is which is not curative. What is cure, what is curative is not told in medical colleges. Then chronic obstructive dehydration, tuberculosis, early tuberculosis, secondary tuberculosis is also possible with homeopathy. And comes to the cirrhosis. Don't think that every disease is curable with allopathic medicine. Cirrhosis, allopathic doctors also, they call terminally ill patient. And cirrhosis is not curable by allopathy. But what happens? They will manage. They will, even the cirrhosis patient, if there is esophageal spasm and patient is vomiting blood, they will apply the clips to the internal arteries. Those clips will subside and melt with the digestive system. And ultimately, for 4 to 5 months, they manage the cirrhosis patient. After 6 months, patient will die. But if you started the early treatment with cirrhosis, the homeopathic treatment will prevent for 15 years to 20 years. And that many cases are being treated in homeopathy. They are having a lifespan of 15 years. This has never came to the light of the scientific world. But when we have done the history, the cirrhosis patients are prolonging the life until and then it is fourth class cirrhosis. Fourth stage cirrhosis means where the liver totally shrinks, where the spleen and pancreas will enlarge, where there will be portal hypertension. Such cases won't come down. But the first stage of cirrhosis of liver, if properly being managed with homeopathy, these homeopathy will control the patient for 15 years. There won't be any cure, but there will be definitely treatment for cirrhosis of liver. This will not be taught. This is curative. This curative is will not be. I say curative because I gave title like that. But this is a patient where treatment can be given. This treatment will not be discussed in college. What type of cirrhosis patient has to be taken? Now come to the snake bites. See, in our old materia medicas and in our old experience books, the authors will write from a nook and corner of the village, patient used to come. I gave for snake bite, particularly strychnine, and for scorpion bite, I have given this medicine and patient survived. That is true, but modern studies were not present. And snake bite patient, if anybody comes to rural area to a homeopathic doctors, in rural areas, the homeopathic doctor will face the difficulty, and keeping and storing so many medicines will be very tough. Then except pandemics. And snake bites have to be controlled and they have to be made proper study. Though proper study is now available, we don't have any collaborative project with snake bite institutes or anti-venom institutes, and homeopathy never made any progress. And this chapter will not be discussed in the medical college. And the physician goes outside and faces the trouble. So these are the some of the things which are curative, what is cure, which cures them is lagging in medical college. And one has to be very accident, how to face accidents. See, you have to give first aid treatment. For example, for snake bite, for accidents. So what type of the treatment that has to be given, which bandage has to be applied, how to control the bleeding, and what are the powers we have been given by which allopathic medicines have to be given, what is the tetanus toxide, how to control the first aid and send him to a higher institute. This type of studies, this type of cures were not taught in homeopathy. Homeopathy means only taking a chronic case and taking the holistic approach, text to case taking, and treating him for 6 months. Unnecessary stressing on symptoms like leukorrhea. Suppose I will tell many patients will ask for leukorrhea, though it is present or not present, and they will stress. And because the leukorrhea is the symptom that has been produced. See, these leukorrhea has been added to the materia medica during Hahnemann time because female provers were very less. No female prover has noticed or explained Hahnemann about the leukorrhea. There were used to be 5 provers, and out of that 5 provers, 4 provers never used to attend. So these leukorrhea symptom has been added to materia medica because when they were treating the case, they also found that leukorrhea came down. Which type of leukorrhea that controls, which type of leukorrhea is correctly a disease, which type of leukorrhea is not a disease, though it is properly explained in our materia medica, over stress has been given to leukorrhea. And if we do specialization, if you read gynecology, the so much of specialization never carries any weight in front of gynecology textbook. So such types of thoughts, the snake bites, the accidents, the minimum disorders, they have to be taught to the physician, which is lagging in our college. Therefore, the homeopathic doctors, when they go to the society, they were not in a position to compete with allopathic doctors. Again, I am telling you, kindly tell to allopathic doctors, all your textbooks are covering homeopathic syllabus. All medicine textbooks are covering homeopathic syllabus. These are some of the homeopathic doctor, our institutes also, our research institutes also do not know. And genetic disorders. See, usually everybody claims about genetic disorder and they think about
Sir, only just 5 more minutes, sir.
Thank you very much, sir. Now,
Hope
before
we can have another session on the same subject because it's a wide subject and it's a very good subject, and really
okay, sir.
we
Now,
got very good knowledge about the history of homeopathy. You told that it is there in the Indian textbook of Indian history that
yes, sir. Yes, sir.
these are
Thank you very much,
the
sir.
Dr. Majumdar has treated the
Yes,
cholera and has become
yes.
the a part of history. But
Thank you very much,
unfortunately,
sir.
most of us have
Now
no idea
we
about
have
that things.
to go for drug relationship. I told
Yes,
you
sir.
that how Rastax is complementary to Bryonia, how Bryonia is
Yes,
complementary.
sir. We need to have such a discussion
And
because
yes,
you are a
because it is
person
not
having
covered in
immense
the
knowledge, and
syllabus,
we would like
and
to.
many people will see the materia medica and prescribe Bryonia after Rastax. The Bryonia symptoms such as dryness of mucous membranes, Rastax left-sided, Bryonia right-sided, how it came, how scientifically they developed, and how we
Sir, can you adjust your camera a little more? We can't see you, only just your forehead and
I see.
up.
Okay, okay,
Yes,
sir.
sir. Yes, sir. Anyway, it's really a very, very good session, sir. Dr. Paul, do you want to add anything, Dr. Paul? You can say a few words here. Please raise your hand so that I can ask you. Yes, Dr. Paul, please Paul Joseph, please unmute and make your suggestions, if possible. Yes.
Hi everyone. This is Dr. Paul Joseph. I am with the right now. I am with the patient because here is the morning around 11:30. So all the patients, they are listening to your talk, Dr. Rao. Really, it's appreciated. That's why I put the message. You are one of the patients. He said the experience comes like a bullet from your from your talk, right? So that's why just I want to mention I want to congratulate you because you have so much of experience. I request the organizers, you have to get the speakers like Dr. Rao, and so we appreciate him, and really it's wonderful experience that you are that you express over here. Thank you so much.
Thank you, Dr. Paul. You are speaking from Canada. Thanks to you for your tolerance. Yeah. Just for your patience and listening to me. Thank you very much.
Yes, sir. What a powerful session was that, really. And you really rocked, sir, because we have no such ideas, but you have really connecting points one by one and making it a big way. That is the beauty of your presentation. Even though you have you are having a lot of things to say,
Yes,
and
sir,
you are
yes, sir.
there
You know very
to
well.
speak. That's
Yes.
why you are running like anything, just like bullet, as just for
Next time we will talk about drug relations, sir, so that everybody will have
yes.
clear.
Yes, anyway, that thing that sir, can you say a little more about the history of that Majumdar
Yes,
case?
sir. Yes, sir. Next time
In which
I will take the
in which
slides and distribute. Yes,
sir,
sir.
in which history book we can find that
The Indian history, sir. Council
Indian
for
history,
Indian history. Yes, sir.
yes, sir, Indian history written by
Were written by Government of India.
the government of India itself.
Yes,
Oh,
yes. Government of India has the only homeopathic chapter that is covered by History Society of India. Indian
okay,
Historical Society. That is a government organization, sir.
Okay, sir.
I
That's
will try my level best to put that on slides, sir.
okay, sir. That's okay. That will be
About him and
very
what was covered.
because we want such a slide, sir, because
Yes,
we
sir.
have to
Yes, sir.
promote
Yes, sir.
these things
I will
among the
put next
public,
time.
because
I will put.
most of the doctors don't have no idea about such things,
Yeah,
sir.
nobody knows, sir.
Yes, sir.
Because they never refer such books.
Only a person like you can bring such things to
I
the
will
notice of the
inform you,
public.
sir. I
Yes,
will put
sir.
on slides. You can note down that.
Anyway, sir, now I invite Dr. Ramparai, sir, to say auto thanks to this session. Dr. Ramparai, sir, please raise. Yes, please unmute. Please unmute. You can say auto thanks to the session also. Please unmute once again. You are muted. Okay.
Correct, sir.
Yes, speak. You can speak now. We can see you. You just you are unmuted. You have already unmuted. You can say the vote of thanks to Dr. Ram Paresh, sir.
Thank you, Dr. Dinesh, and congratulations, Dr. Prakash Rao, sir. Very good, excellent session. Beautiful describe of what is cure and what is curative. One-sided disease, any types of disease, cure and curative. Very, very thanks, sir. Behalf of IFPH, very, very thanks, sir. Again, presentation, IFPH. Thank you, sir.
Okay. Thank you, Dr. Prakash Rao, sir, and those who attended the session. With that, we come to the end of the day.
Thank you, sir. Thank you.
Yes, sir. Sir is there. Sir, you want to say anything more?
No, nothing, sir. Manoj is waiting in your storeroom. You kindly permit. Thank you very much. Thank you very much. Next time we will talk about drug relations, sir.
Okay, thank you very much, sir.
What is the science that is present? What will not be? See, the drug relationship is not taught in medical colleges. We have a
Okay.
defectiveness in
Okay,
that.
we will
Okay.
have to
Okay, sir.
put all these things to the notice of
Yes, yes.
our professors who are
Yes, sir.
doing all these things, preparing the curriculum and all those things. Anyway,
Okay, sir.
and
Yes,
thank
sir.
you once again to all,
Yes, sir.
particularly Prakash Rao, sir. Thank you. Good night.
Thank you, sir.
everyone. And
Thank
tomorrow
you,
we
sir.
will have a-
Thank you. Very, very excellent session, sir. Very
Namaskar.
nice presentation. And according
tomorrow we will have a session from Dr. Vijayan
So I
from
will take
Kerala.
leave, sir. Namaskar, sir.
Okay, sir.
Dr. Ganesh Manoj ji, entirely
Thank
changed
you,
it.
sir.
Thank you.
It's over to Dr. Mariamma John to moderate the Malayalam session now.